Welcome back to my channel, Dr. SP. Today we are going to talk about Wells clinical prediction rule for pulmonary embolism. Clinical feature points. The Wells score has 7 main criteria. The first criteria is clinical signs of deep vein thrombosis. In any patient, if you have seen clinical signs of deep vein thrombosis, the score for this criteria is 3. The second criteria is if alternative diagnosis is less likely than PE. That means pulmonary embolism. If you think that these patients have more likely pulmonary embolism than other diagnosis, then the score is 3. The third criteria is heart rate. If the heart rate is greater than 100 beats per minute, then the score is 1.5. And the fourth criteria is immobilization. If this patient is immobilized greater than or equal to 3 days, or he has undergone major surgery in previous 4 weeks, then the score is 1.5. The fifth criteria is if this patient has history of deep vein thrombosis or pulmonary embolism, the score is 1.5. If this patient has hemoptysis, the score is 1. The seventh criteria is malignancy. If this patient has malignancy or he have treated for this malignancy within 6 months or palliative, the score is 1. Adding up to all the scores of each criteria, if you detect the score is greater than 6, then the probability of pulmonary embolism in this patient is high, and if the score is between 2 to 6, then the probability is intermediate, and if this score is less than 2, then the probability of getting a pulmonary embolism in a patient is very low or low. I hope this video is helpful for everyone. Thank you.